A very warm good evening to one and all. On behalf of Ayurveda Map, I invite you all for today's session. So today we have the Anubhava. It's the free webinar series. It is organized by Ayurveda Map and sponsored by Dr. P. Ali Kutti's Cortical Ayurveda Pharmacy. When speaking about Dr. P. Ali Kutti's Cortical Ayurveda Pharmacy, it is situated at Cortical, Malappuram. They have almost 400 plus classical products and also 40 plus proprietary medicines. So they have Arishtas, Asavas, Lehias, etc. So if you need any kind of medicines from Dr. P. Ali Kutti's Cortical Ayurveda Pharmacy, you can contact Dr. Jasul. Ayurveda Map was started by a group of young doctors in the year 2016, and it was officially inaugurated by the most respected Dr. P.M. Warrior Sir in the year 2017. So at first we had in-hand practical sessions. So these are our in-hand practical sessions. So we had sessions about marma, bandaging session, and our main session was about the cosmetic therapies. Then we had about the Medisujok. Then we had about Agni Karma and the business management for medical professionals. And due to the COVID situations and with the warm responses also that we received from our participants, we continued our journey even with the during the COVID situations also. So we switched on from in-hand practical sessions to online sessions. So we kickstart with Varnam, that is cosmetic therapy session, and we had dermatology, and we had sessions on thyroid diseases and about the reorientation program to Ayurveda students, about the Ayurveda product making, Dhyana, the therapeutic yoga session, Vibha, the cosmetic session. Then we had about the gynecology session, about the cupping session. And again, we had about the Garbha Samskara, then cosmetic preparations. And we have also started 1 year postgraduate diploma in Ayurveda cosmetology. It started in February 2022. And we also have a new venture, that is Swadhyaya, to support the students academically during the pandemic time. This is still in process. We give away recorded classes, detailed notes, and we also have one-to-one doubt clearance also. And I'm happy to announce a new session, that is Prakasha. It is an online clinical discussion with the most efficient Dr. M.R. Vasudevan Nambudri sir. It will be conducted in Malayalam language, and there will be total 8 classes, that is weekly 1 class. Mostly on Wednesdays we are planning to keep the class. So it will start from next week onwards. The topics that will be discussed will be regarding osteoarthritis, cervical spondylosis, lumbar spondylosis, prameham, vata shonita, the cancer treatment, and rasayana treatments. So these will be conducted each week. Around 1 or 1.5 hours of class will be there. The language will be in Malayalam medium. So now we are here at Anubhava free session. Today we have the most eminent Dr. Rajmohan V. He'll be taking about the clinical emergency in day-to-day practice and its approach. So when speaking about her, he is the Associate Professor, Department of Rasashastra and Vaishujya Kalpana, Government Ayurveda College, Trivandrum. And he did his BAMS and MD from the Government Ayurveda College, Trivandrum. He was a medical officer at the Department of Indian System of Medicine and research officer at the Drug Standardization Unit under the Directorate of Ayurveda Medical Education, Government of India. His teaching career started at Vaidyaratnam PS Warrior Ayurveda College, Cortical, and subsequently to Government Ayurveda College, Trivandrum, and Government Ayurveda College, Kannur. Presently, he is the Associate Professor of Rasashastra and Vaishujya Kalpana at Government Ayurveda College, Trivandrum. So with utmost happiness, I invite you, sir, for the session. Over to you, sir.
Thank you so much, Dr. Radhika. Let us move on to the session directly.
Sir, are you able to share your screen, sir?
Yeah, I'm trying. Okay.
Okay, sir.
Is it visible now?
Yes, sir, it's visible now.
Okay. I think the full screen is on, right?
Perfect, sir.
Okay. Good evening, one and all. Today we are about to discuss uh, understanding clinical emergencies. We are not going to talk about much about how we are going to manage these clinical emergencies and all those things, but we just want to discuss about how we are going to identify these clinical emergencies. How we are going to identify these clinical emergencies while in our day-to-day practice. So there are quite a few number of clinical emergencies that we need to focus on, so that in our clinical practice, in our day-to-day practice, some abdominal conditions, some cardiopulmonary conditions that may arise. So we must be knowledgeable enough to understand those situations to identify early severity of that disease. So that is the objective. We are going to discuss about a couple of algorithms how to identify a blanket identification of some of the emergencies, and we will discuss a little bit deeper into that. Because as you all aware that there are a lot of clinical emergency conditions are there, starting from endocrine conditions, abdominal conditions, neurological conditions. So it is not possible to discuss all together here, but we will focus only to some of them. Usually, probably as an Ayurvedic practitioner we may encounter. So first of all, moving on to our topic. As a medical professional, we must have certain qualities. The first quality of that is being current. We have to update ourselves with the latest trend in medicine, latest trend in Ayurveda, as well as latest trend in which field we are practicing. Suppose if you are practicing Prasuti and Stri Roga, you must be very current in that in gynecology and obstetric practice that is happening around you. If you are a specialist in Shalya Tantra, you have to be well aware that if you are practicing,
Hello, sir.
Yeah. Okay.
Okay.
There is okay. I think the video was off, right? Okay. So if you are a pediatric practitioner, that a Kaumara practitioner, all those emergencies that are happening, all those things that are happening in that pediatric field, you need to update regularly. So that being current is one of the major aspect a physician or a practitioner or a GP, general practitioner, has to follow. I'll give you a tip for that. You may register in Medscape site. You have to register. You can register in Medscape site. Medscape is the largest, the largest database regarding a practitioner can access, and you register based on your specialty, whatever specialty you are practicing in the in your setting. If you are a general practitioner, you can register for internal medicine, or if you are a Shalendra practitioner, you can register for surgery or orthopedics, whatever you want. And you can download the app, and you can continue to use the vast area of resources that are available worldwide. And it is current, and it is up to date, and it is current every day, or once in 2 days. You can see that a large data is coming to that app, and every time it is updated. So when you are in practice, you can quickly go through the even the patient in front of you can quickly go through that app, and you can check what are the current investigations available, and all those things you can do. So it's a very, very important factor is that you have to be very current as a general practitioner. And the second thing is listening well. Most of the issues we have, we are coming across with our students while we are teaching in our medical schools. The problem is that they are most of them are not listening well. They jump into conclusions, even without hearing properly, listening properly to the clinical symptoms the patients are telling. They jump into conclusions. This jumping into conclusions are not good in clinical practice. We have very good teachers. I must remember Dr. M.R. Vasudevan Nambudri sir, and as well as Dr. Sriyandan Nair sir. They take at least took 15 to 20 minutes to interact with a patient, and they will go through all the finer aspects, and that is most important. You have to ask leading questions. The listening must be reflective. It should not be passive. That's you are simply listening to the patient, but you need to keep an active or reflective listening, that every time leading questions must be asked to the patient, so that the actual facts regarding the disease must be extracted out. So listening well is one of the major qualities you have to keep as a general practitioner. That would probably help you to avoid these kinds of medical emergencies happening in your clinic or in your hospital. See, most of the Ayurvedic hospitals are most of the time may not be acquainted with, may not have the intensive care facilities and operation theaters like that. Of course, some of the hospitals do have, but what we can do is we can have, if you are running a Ayurvedic hospitals, you may have tie up with some of the nearest hospital, so that if anything happens to a patient, you can shift that patients immediately to the hospital and calling them, giving proper directions. A patient is coming probably with this particular condition, so that they can prepare their facilities. They can arrange adequate facilities there in the hospital, so that the patient will get right care at the right time. So these kinds of approaches are definitely necessary. You know that nowadays the acceptance of Ayurveda around the globe, as well as particularly in India, is increasing every day. So maybe more and more number of patients will approach you for a wide variety of diseases, particularly some of the, I must say, thrown away cases, some of the cases that have been actually coming from allopathic hospitals, that there is no treatment. Some of the autoimmune conditions, some of the malignancies may approach Ayurvedic hospitals for their treatment. So sometimes some clinical emergencies may occur, or surgical emergencies may occur to that patient. So if you are running a hospital or running a clinic, particularly if you are running a hospital, definitely it is a good practice. It would be a good practice for you to have a tie-up with some of the hospitals, so that you can refer the patients based on an algorithm properly to these hospitals. And before the patient reaches the hospital, you can give them proper directions that the patient is coming with this particular condition. So all these things may be necessary. These are the things may be probably necessary for the patient to be stabilized. So all these conditions are necessary. So the third thing is that is also a very important thing while we are considering an emergency conditions, or when a patient reaching to us, when a patient coming to our clinic or hospital, if they are having some suddenly developing an emergency situations, the first thing the doctor may have an anxiety. So being comfortable with dealing different situations, we always we must keep calm. Some emergencies may even happen to our family. So in order to give the best out of you, you need to remain very calm and composed. So being comfortable with dealing different situations. Sometimes we may be called for diagnosing a death. So if we are very anxious, probably we may miss some very vital clues and vital things. Likewise, if you are called for diagnosing a case or looking at a patient, a debilitated patients, examining a debilitated patients, definitely we have to be very calm and composed, so that the maximum symptoms and signs we may obtain, and that is very necessary also. So that is the being comfortable with the different situations, and ability to remain calm is a very important quality a doctor must procure. Detail oriented. We should not restrain ourselves to the generalized terms. Of course, I'm having a stomach pain. Stomach pain, of course, is a very umbrella term that usually patients will tell. That sometimes it may be arising from an intestine, sometimes it may arising from a stomach proper, sometimes it could be from the it could be a chest pain. So we must have very detail oriented, and of course we must be very well thorough with the diagnostic textbooks we have learned. while you are in a general practice, you need have a thorough and proper understanding how to examine a patient and how to take all the details regarding clinical examinations, details through clinical examinations. So the next thing is knowledge and curiosity. You must have the curiosity to attain knowledge every time. Whatever sources you are having, of course, I can see that quite a lot number of students or practitioners are attending this seminar. So that curiosity must be there every time. So continuing medical education programs are so necessary, and I would like to congratulate the organizers of this program, that they are doing a wonderful job by keeping up to date with so many informations. Next thing, I think it is a clinical discussion with Dr. M.R. Vasudevan sir. He's having a vast experience in that field, so that's also a very good thing. So we must be knowledge loving, and that quest for knowledge should always be there in that doctor. So a doctor should learn throughout his life. A doctor should be updated throughout his life. So the persistent approaches and consistent behavior and consistent learning thing is also another quality of a medical professional, particularly those who are working as a general practitioner, because general practitioners usually interact more with the grassroots level population. There's all type of population. Sometimes they may be, particularly you think about a general practitioner who is situated in the rural area. Particularly, you can think about an ISM medical officer, Indian Systems of Medicine medical officer at Kerala. He's actually interacting with the most probably all strata of population, particularly the poor and the poorest. So that skill of communication, that skilled communication is so important, so that sometimes you have to move down, and sometimes you have to move up from your communication level, so from your education level, to interact with the population. And you have to be very very well versed in communication and all those things. So critical thinking, one of the major ability of a doctor, Shauryam Ashukriya Shastra Taishnyam, you have learned it in Sushrita Samhita. Shauryam, you have to be courageous, and courageous in taking decisions, and you also need to give optimal timing. A decision making should be optimal. It should not be too late, and it should not be too fast. Too late decisions may end up in some a delayed probably end up in some clinical worsening of clinical conditions, and jumping into conclusions may not be able to extract proper data regarding the condition. So critical thinking and optimal timing, all these things as a medical professional is always necessary. So these are the general qualities as a medical professional. You must be very focused while you are practicing, so that early detection of conditions are very important. Okay, there are certain things, that is from hearing to listening. There are certain type of listening we need. Listening are types of listening: competitive listening or combative listening, passive listening or active listening. And I must say that I already told you, competitive listening is sort of a dispute, or like a tarka. We are doing a tarka to the patient. Whatever patient is telling, we are countering that. It is not a good way of listening to a patient. Passive listening or attentive listening is a good way to listen, but the problem is that some crucial thing we may miss. So passive listening means you are keeping quiet and listening, of course, very well to the patient, but that is also not sufficient. We always listen to the patient, particularly if you really need to catch some of the worsening clinical situations. Your listening should be active and reflective. That is very important, to have an active and reflective listening. What is active and reflective listening? Whenever a patient is telling something, you are asking back, you are reciprocating with certain questions to make it very clear. Someone is telling that my limb fractured way back in 2018. and after some time you told that after before two years actually you were limb fracture, right? So likewise some leading question should be there. You said that you had an abdominal pain earlier, right? So likewise these leading questions should be asked to elicit certain symptoms and to things clear. That is known as active or reflective listening. This will of course help in getting attention of the patient, as well as the patient feel very comfortable with that. And of course, the patients are collections of facts. What we need is facts. What we need is facts regarding the disease. So we need to understand the facts, the first level. And the second level, the patient also may have certain thoughts and beliefs. The patient may have certain beliefs. He may believe that this disease is caused by certain evil forces. So that kinds of thoughts and thinkings must be there with the patients. You need not fight with patients that all these stuffs are very, very idiotic. So you should not think about that. Simply respect those thoughts and beliefs. You do not initiate and argue with them. So there are facts. We need to understand the facts and the feelings and emotions. The patients will have a lot of feelings and emotions because he may not be able to take the medicines, or he may not be able to get admitted in your hospital because unless he worked, his family may not be able to get the daily bread. So that kind of feelings and emotions also will be there with the patient. So you need to consider that feelings and emotions. You need to respect the thoughts and beliefs of the patients, and also you need to extract the facts, so that facts are always important. So that is regarding the general practice. How as a doctor in general practice, what are the things? I will just go back to the slides again in order to keep that in your mind. Qualities as a medical professional is being current. You have to listen well, being comfortable with dealing different situations. The general practice means sometimes outrageous patients will come, sometimes patients will cry, sometimes patients will argue, sometimes patients may even threaten you. So all those conditions will arise. So you need to explain things properly to the patients, communicate very well to the patients. That is important. And you must have that ability to remain calm. A doctor should be detail oriented. Think about the finest details. See, there is a guideline for how to write a prescription. While you are writing a prescription, if you need to strike off something, just give a single line strike off. That means your confusions also matters. So all those details are necessary. You must have that knowledge and curiosity, very persistent and consistent with your performance, skilled at communication, very rapport. That word is rapport. You need to have a very good rapport with your patients, and critical thinking always that. And the listening, you need to have a reflective listening, asking leading questions to the patient to extract the facts, and you must respect their beliefs, and also you must respect their feelings and emotions. So the major symptoms that particularly you have to watch for different systems definitely are listed here. The symptoms of respiratory systems are definitely dyspnea is one of the worst symptoms ever in a respiratory system. Dyspnea, wheeze, cough, sputum, hemoptysis, and chest pain are the usual symptoms of respiratory systems. You know that how much dyspnea is important, because dyspnea can arise from a lot of conditions. Even when there is CNS depression, dyspnea can cause. When there is respiratory distress, dyspnea can arise. When there is cardiac conditions, dyspnea can arise. So dyspnea is a very worse symptom. So there is a term known as triage. Triage means when a mass accident is occurring, or when in an emergency room, which patients, the preference of the patient should be given according to triage guidelines, TRIAGE. So you may note it down and you may go through and read these triage guidelines. These triage guidelines are so important to make clinical decisions in a mass emergency conditions and all. So in that triage guideline, the primordial preference is given to a person with dyspnea. Don't forget that a person having dyspnea should occupy an ambulance first, A person having respiratory difficulty and dyspnea should occupy an ICU bed. So the respiratory system, particularly dyspnea, is given primordial importance in triage guidelines also. So wheezing, cough, sputum, hemoptysis. You know hemoptysis, what is that? Chest pain. Of course, chest pain with dyspnea is always a preference. So these are the common respiratory system symptoms we that may come across in your day-to-day practice. Dyspnea can be dyspnea arising from an asthmatic lung, or dyspnea can also arising from asthmatic lung. That means that asthma itself can be classified into pulmonary origin and cardiac origin. So cardiac origin asthma is always need to be evaluated and all need to attend very fast. So these are certain symptoms that may lead to cardiac asthma and pulmonary asthma. Cardiac asthma, you know that it is paroxysmal nocturnal dyspnea will be there when the patient is lying down, suddenly the dyspnea will increase. So all those symptoms you have learned in basic medical school, you need to brush up again. So cardiovascular system, you know that the chest pain, orthopnea and paroxysmal nocturnal dyspnea. Orthopnea means when you are lying down, there is a dyspnea, and nocturnal dyspnea means when you are sleeping, the patient feel dyspnea and suddenly he sit again. So that is the paroxysmal nocturnal dyspnea. Ankle swelling for an ambulatory patient, and if the patient is lying down all the time, there will be edema around the edema in the sacroiliac region. So chest pain is one of the features of cardiovascular system, particularly orthopnea is a thing, dyspnea aggravating on lying down, and nocturnal dyspnea aggravating on night time or sleeping time. Ankle swelling, dependent edema. I must say that it is dependent edema. That is, if the patient is ambulatory, that edema will be on the ankle region. But if the patient is lying down, the edema will be on the around the scapula as well as in the sacroiliac region. So gastrointestinal systems, abdominal pain, you know that acute abdominal pain is an emergency. Sometimes it may have an emergency conditions. Acute appendicitis or acute intestinal obstruction is a very severe condition. Acute pancreatitis, again a severe condition. And cholecystitis is not an emergency, but still these acute abdominal conditions are there and chronic abdominal conditions are there. We can classify those abdominal conditions into two types, that is inflammatory conditions and colicky conditions. So all those conditions usually come to our day-to-day practice, abdominal pain and all. You need to properly identify and you need to assess the severity of that condition and refer the patient accordingly. So the nausea, vomiting, hematemesis. Hematemesis is usually occurring with hepatic conditions, and when there is increased hepatic portal circulation, pressure in the hepatic portal circulation, and bowel habits, sudden change in the bowel habits, also a disease conditions, and bleeding per rectum, melena. All those things, bleeding per rectum and melena, all those things are usually gastrointestinal symptoms. Urogenital system, you know that the frequency of micturition is increased in so many conditions, like in diabetes insipidus, diabetes mellitus, as well as in benign prostatic hypertrophy, infections, urinary tract infections, as well as in bladder infections. All those conditions, this frequency is increased, particularly nocturia is there, polydipsia is there, loin pain, hematuria. All those conditions are associated with the urogenital system, but majority of these things may not cause an emergency, but you need to be very focused, and particularly in urogenital system, in genital system, in female genital system, a sudden onset of pain in a married woman in the iliac region probably may due to an ectopic pregnancy also. Ectopic pregnancy, rupturing of the ectopic pregnancy is definitely an emergency conditions. So central nervous system, headaches, visual disturbances, of course, sleep, hearing, tinnitus, lightheadedness, blackouts, fits, unsteady gait, weakness, and paresthesia. Majority of the central nervous system symptoms are, of course, you know that it is sometimes it is very clinical emergency, and stroke. So many, all those symptoms are mainly originating from the central nervous systems, usually associated with the clinical emergencies. And musculoskeletal systems, not much clinical emergency, but still myalgia, arthralgia. Myalgia means muscle pain, and arthralgia means joint pain. Back pain, joint swelling are the common symptoms that we encounter with the musculoskeletal systems. And psychiatric conditions, the mental state examination will be taught more formally in your psychiatric addressment. Depression is common and may often coexist with the physical ill health. The mental psychological status of a patient is always important. Depending upon the psychological status, sometimes a person may even having a dissociative disorder may even mimic some of the severe conditions. So you must be very objective towards clinical symptoms. Subjective parameters usually that depends upon is always having a subjectivity and depends upon the person's sattva. So objective parameters are always necessary to assess clinical emergency. So these are the major symptoms associated with the various systems. Respiratory system, dyspnea. I told you dyspnea is one of the major symptom you need to consider. And chest pain of cardiac origin. When taken to gastrointestinal system, abdominal pain is one of the major thing. So intramenstrual bleeding, postcoital bleeding. So many symptoms are there. Central nervous, majority of the central nervous systems symptoms are very, you must be very watchful, and even psychiatric condition assessment are also very important. So let us learn a scale that will help you in assessing the severity of a disease very earlier. This is very important, so you may focus here. This is a scale which is known as severity early warning score, standard early warning score or severity early warning score. This is based on the vitals of our body, and you can see that there is a scoring system. I will just take a pen. So laser point. You can see that there is a scoring system. This is the score. It starts, it's a normalcy is the 0 center, and it moves either way. It moves either way. And you can also see that the first one is respiratory rate. And you can see that from 9 to 20 is the normal. These all these factors that kept below this 0 is the normal score. That is 0. The score is 0 when the respiratory rate is between 9 to 20. And oxygen saturation is the score is 0 when it is above or equal to 93. It is same. You have now you know that regarding this COVID condition also you have learned that below 93 it is always this oxygen therapy is advised, and temperature should be between 36 to 37.9 degrees centigrade. The score will be 0. And systolic blood pressure, it is not diastolic blood pressure. We are considering here when there is when the assessment of severity of conditions, it is systolic blood pressure that is ranging from 100 to 199. And heartbeats, definitely score is normal. When 0, that means heart rate is 50 to 99. 50 to 99. So AVPU response, that is unresponsive, pain, verbal only, alert. So alert, if the person is alert, the score would be probably a 0. So you can move either way, this direction as well as in this direction. Let me take a pen so that it will be much easier. You can go in this direction as well as you can go in this direction based on the clinical situation of the patient. So the advantage of this cycle is I would probably explain what exactly this scale is necessary. You have to keep the scale in your clinical setting, whether it is a dispensary or a hospital. When a person is suddenly collapsing in front of you, you may simply go through this first stabilize the patient by if it is a cardiopulmonary resuscitation is necessary. You can go through several videos are available from lot of sites, even Mayo Clinic. So many good medical institutions are offering videos regarding how to conduct a cardiopulmonary resuscitation and basic cardiac life support things. And stabilize the patient first, keep the patient in a comfortable position, clinically stable, stabilized position, and you examine the patient by using this scale. And based on the score you are getting, you may have certain idea regarding what to do with the patient. That is the important thing. Suppose a patient is collapsing in front of you. The thing is that the patient is coming to your clinic, and before starting any interrogation, any communication, the patient suddenly collapses and you don't know who he is, you don't know what is he, you don't know the history of the patient, and you stabilize the patient and you go through this scale. See, the first thing is a respiratory rate and oxygen saturation. Respiratory rate and oxygen saturation is the first two. The next thing is the temperature, body temperature. And the third and fourth one is the heart rate and blood pressure. And the last one is the AVPO response, that is unresponsive, pain, verbal, and alert. So these, we can classify these symptoms into 4 categories. And the first 2 category, you know that it addresses the status of the respiratory system, that is respiratory rate and oxygen saturation. Of course, it indirectly addresses cardiopulmonary system, because when there is a cardiac emergency, when there is a cardiac condition, sometimes there would be pulmonary edema. So definitely the oxygen saturation will be lowered and the respiratory rate will be increased. So that is the thing. And the temperature, definitely look for certain infections, temperature or fever, whether there is a fever definitely looking for certain infections, whether the person is having any infection or not. And the next 2 things, that is, it is clear that it is addressing the circulatory system, that is systolic blood pressure and heart rate. And the third one, definitely checking for the central nervous system, that's particularly the response from the brain. So all these constitute exactly the vitals of our body. So I have a suggestion for all of you, that particularly for the young doctors who are just into the practice, that when you are examining a person, if the respiratory rate is altered, usually you will simply say that the patient's respiratory rate is altered. You usually don't look into the other vitals. So if any one of the vitals seems to be affected, definitely you need to check all the vitals. And it is important that for all the patients, you at least once in a day, you need to check the vitals every day. And particularly for debilitated person, particularly for a patient with a severity of illness, definitely you need to examine them regularly with this respiratory, with these vitals. And when you are talking, when you are saying hello to a patient, hello to an admitted patient, you simply take his wrist in your hand and you simply check his pulse. So pulse also will tell you a lot of things. So that is whether the pulse is very regular, whether is tachycardic, whether is bradycardic. So a lot of information you will get, whether the pulse is regular. So always well aware with the vitals of the patients. So that is very important. So the another advantage of thing is that the patient do not need to talk regarding these conditions, because all these are objective parameters. All these are objective parameters you need to measure. Only instrument you need is this oxygen saturation. For that, you need a pulse oximeter. An oximeter is necessary to get that. So that is a very necessary because an oxy, a very good quality. Please purchase a very good quality pulse oximeter as well as a very good quality stethoscope. Both things are very important in your day-to-day practice. So this pulse oximeter is necessary for this. Majority of the severity early warning score always need this oxygen saturation level. So what is the relevance of this? What exactly this emergency assessment, severity assessment scale is looking into is that, see, The first two is respiratory rate and oxygen saturation. The next is the infection, and the other two are addressing the cardiac system, and the last one is the central nervous system. See, even though there are thousands and thousands of diseases, when it comes to the severity of illness, when it comes to death, death has only three ways. That is its base. Death has only three ways. If the person has reached a particular severity of the illness, and if he is going for moving towards death, or moving towards very severity of the disease, what is going to happen is that the death is of three types. So the severity, when a patient is become clinically severe, he will either move to the respiratory distress, or to the cardiac distress, or to the CNS distress. So if that means if it proceeds, the patient, there is three types of death. The first type of death is asphyxial death, that is arising from the pulmonary system, and the next is the syncopical death, that is arising from the cardiac system, and the next is the circulatory system, and the next is the comatose death, that is arising from the central nervous system. So this scale is looking not much thing, but it is only looking through the vitals given here, through the scoring system given here. It is simply looking into whether this patient has reached a severity, so that it may proceed to death, or it may proceed to a much worse conditions. So the first two things look into pulmonary system. So a score of 3, 9 to 20, a respiration of 9 to 20 is respiratory rate of 9 to 20 is considered to be normal, and 21 to 30 is score 1, 31 to 35 is 2, and greater than 36 is given score 3, and less than 8 is always 3. And you go to oxygen saturation, 93, score 93 or above is normal, 90 to 92 is 1, 85 to 89 is 2, and less than 85 is score 3. And temperature, you can see that 36 to 37.9 is the normal, and you have the upper values and the above values and subnormal values are there. Systolic blood pressure is considered over diastolic blood pressure, and you can see that it is only above 200, it is given the score of 2, and it is lowered. If it is lowered, it reaches again the score of 3 at 69. Heart rate, of course, it is 50 to 99 is considered as normal, 50 to 99 is considered as a normal, and 100 to 109, 100 to 100, above 130, it is 3 is considered, 100 to 109 is 1. So heart rate lowered limit is 29, it is a very severe condition, going to heart failure. AVPU response means unresponsive, whether the patient is unresponsive or whether the patient is pain only. When we giving a glabellar, when we giving a pressure over the periorbital area, or a triceps pinch, the person is pinching, or the person is giving a sound like something like that, it is a pain only response. He is not responding to verbal call, Anil or Ramesh. We are calling him loudly. There is no response, so there is no verbal response. And the patient is alert, whether it is coherent or non-coherent, the patient is alert, the score is 0. So I will just give you a clinical condition, and I will explain this. While I was in night duty in my college, that is Government Ayurveda College, Thiruvananthapuram, there was a call from one of the ward by the duty nurse. And she was telling that there is a patient. That patient is, I think, she thought that the patient was consumed alcohol. That his talk is non-coherent, and he is like quarreling with his fellow patients and all. So I just reached there, and I suddenly conducted this particular test, this scale we have applied. And we have seen that some quite interesting findings were there. Actually his respiratory rate was pretty elevated, and it was 38 per minute. So that is the respiratory rate. So that accounts for a score of 3. The first thing was the respiratory rate of that patient was 36. And the oxygen saturation was 87. And the oxygen saturation was 87. So it accounts for a score of 2. And the next thing was he was having a temperature of around 38. So it is a temperature of around 38 accounts for a score of 1. And the next thing was systolic blood pressure was actually it was normal, no problem. Heart rate was actually no problem, and he was alert, but he was non-coherent. He was not responding to things and all those things. He was simply talking non-coherently. So the score here is 3 plus 2 plus 1, that is around 5. This respiratory rate, and I think that it is 3, 1, and 2. Okay, it is 6. 2 plus 1, 3, and 3 plus 3, 6. Actually, this 6 score of 6, I will show the next thing. Score of 6 greater than or equal to 6 is immediate intensive care is necessary. So a score of 0 to 1 means routine observation should be continued, and score of 2 to 3 means hourly observations are needed. Score 4 to 5 is an alert, and score 6 means an intensive care is necessary. So this person immediately need an intensive care. See, we didn't interrogate him. We simply relied on this scale. So this is a severity, advantage of severity, early warning score. Actually, let us look into what happened to this patient. What actually happened to this patient. See, the respiratory rate is high. That means the respiratory rate is high means that there is an increased respiratory urge. That is probably due to the decreased oxygen saturation. Why this oxygen saturation is there, decreased oxygen saturation is there? So we have to look into any other thing. That means the temperature is elevated to 1 degree centigrade. That means some infection is going on. Of course, some infection is going on. When we go after that, when we have referred the patient immediately because the oxygen saturation was very low. So we have connected with him with oxygen and referred to medical college immediately. So it is an intensive care is necessary. So the temperature is elevated. And when we go through the case sheet, the patient was having cough and fever. Probably the patient is having a pneumonia-like condition. So a lower respiratory tract infection, preventing the lung is infected, and that is when there is inflammation, that oxygen air exchange is prevented, hindered. That is causing the lowering of oxygen saturation. There is a reciprocal increase in the respiratory attempt. So that is an infectious condition of the respiratory system. So that is very clear. It is very crystal clear that this person is having certain respiratory conditions. So you can practice this by utilizing. And when there is a rise of temperature, fever means a rise of temperature up to 41 degrees centigrade. Above that 41 degrees centigrade, it is no longer fever. It is termed as hyperpyrexia. It is a different conditions. And a fever can be from classified into, it can be from certain infections. It can be certain from inflammations, or it can be certain from certain infestations, and it can also be from certain collections. So if something is collecting in your body, likewise an internal organ is bleeding, and that blood is collected in the abdomen, usually in the peritoneum or in the pleura or something, definitely something is collecting there. Some pus is collecting in the body, or some fluid is collecting in the body, some intestinal obstruction is there, and the bowel has ruptured, and the content is into the abdominal cavity. Definitely some collection is there. There will be a pyrexia, and most probably the pyrexia is known as a pyrexia of unknown origin. And if some infections will be there, if there is an infection, that is if there is a bacterial infection or a viral infection, you know that there will be a fever. And there is a typical pattern of these bacterial or viral fevers are there. most often, quite often, viral fevers will have very high temperatures like 102, 103, 104 temperature, most probably with the viral infections. You can see that in COVID also there is high temperature. In normal viral conditions also there will be high temperatures will be there. And the other thing is that high temperature will be there, but in bacterial infections, usually will be localized. Someone is having a urinary tract infection, there will be a rise of temperature to the tune of at least 1 degree or 1.5 degree rise of temperature, and the patient feel something like a fever. Quite often. There won't be any there won't be much high temperatures, but there will be a simple rise of 1 or 2 temperature and the patient feel unwell. Most probably that will be urinary tract infection, and if a gum is inflamed, definitely you will have a fever, and throat infection, it is bacterial origin, you will have fever, and there will be localized infection. And if it is generalized infection from the bacteria like septicemia is nothing but active bacterial toxin in your blood. When we look into there will be subnormal temperatures in septicemia. You can see the temperature. Maybe it is 34, the score of 3, and the BP will be lowered, systolic blood pressure will be lowered around 70 to 79, and heart rate also come low, that is 30 to 39. You can see that the score is 2 plus 2 plus 4 and 3, it is 7. So there is a very, and the person most of the time will be sometimes maybe verbal only. So likewise, you can calculate the severity and send the patient accordingly, and you also will get a clue. So coming back to what I was explaining regarding fever, so infections of bacterial origin, usually the temperature will be generally maybe some conditions there will be rising temperatures and all. In septicemia also sometimes the temperature will be high. Subnormal temperatures and loss of systolic blood pressure, etc., is another the bad prognosing septicemia. So these and some inflammatory conditions also can cause fever, like autoimmune conditions like joint inflammations. Some of the joint inflammations, seronegative arthritis, or all those things also can cause temperature. Infestations, parasitic infestations can cause, malarial parasite infestation can cause rise of body temperature and all those things. So even bleeding, let us check what will be the score of symptoms of a bleeding. Bleeding, that means there will be rise of tachycardia will be there usually for bleeding. And again, what happened is that the systolic blood pressure will be lowered, and heart rate and systolic blood pressure, that itself will give you a 3 to 5 score. You need to and sometimes saturation respiratory rate also may increase. So these are that is the importance of this particular scale. There is no need for you to by heart this scale, and I suggest you not to by heart this scale. You just keep it there in your practice, and you just practice this quite few times. And one advantage is that suddenly a person is coming telling that I am having a chest pain, and you have gone through this scale, and you have seen that there is nothing abnormal in that. The oxygen saturation is normal, respiratory rate is normal, temperature is normal, systolic blood pressure is normal, heart rate is also mildly elevated, that is it is around 95, nothing to worry, and the person is very alert. That means the person is actually mimicking, or actually she is having a dissociative disorder, seeking attention of yourself. Likewise, this mimicking of conditions can also easily be detected, so that the precious time or precious space also can be saved. And this thing is very important, this AVPU response. You know that Glasgow's coma scale is the full scale that we are using for assessing central nervous system anomalies and abnormalities or emergencies. It's some sort of a constricted version of Glasgow's Coma Scale, ABPU response, whether the patient is alert, person is alert, whether the person is responding only to when you call loudly, or that is if there is a verbal response. If there is no verbal response, try with pain. Pain means triceps pinch. Please look into my video. So triceps pinch means you can elicit a pain, deep pain. Superficial pain, pinching over the skin will give you a superficial pain. If you pinch to the triceps, that will give you a deep pain. So that deep pain sometimes occupy the central tracts, and it may stimulate the brain, and sometimes you can get so there is a pain only response. If the person is unresponsive, that means there is severe issues with the central nervous system. So that is the scale. It is severity early warning score system. So practice it. It is very very good. So this is the interpretation of that thing. Score 0 to 1, only routine observation is necessary. You need not worry. Routine observation you have to give. If the score has elevated to 2 to 3, hourly observations are necessary. Hourly observations are necessary. Score 4 to 5 means you have to follow extreme alert, and it may anytime it may cross that 5 score mark and enter 6 or 6 and 6 or above score is very important. And when you are referring the patient, you write all these parameters. What was the respiratory rate? What was the oxygen saturation? What was the temperature? What was the heart rate? And what was the systolic blood pressure? And what was the patient's AVPU response while referring the patient? This will give a clear picture of the attending emergency physician at the hospital. They will make immediate arrangements. Otherwise, they have to do a preliminary evaluation whether this patient go to the neurology ward, or to the respiratory ward, or to the cardiac ward, or which physician should, or which practitioner should, which doctor should attend this particular patient. So if you have the severity early warning score system very effectively noted in the referral thing, definitely the entire thing will be very much easier for the attending doctors at the receiving end. So that is about this score. Okay. And while coming to Ayurveda, I think probably you also aware that whether it is Ayurveda or in clinical practice, in general clinical practice, the worst sign you have to always look for is SOFA. SOFA means you know that an edema condition, whether it is generalized or localized edema, is not a good sign. Edema is, we know that as far as Ayurveda is concerned, it is the expression of ama. Ama in Costa we call it as ama, and ama in Shaka usually we use the term shofa. Or otherwise, I would probably say that a shofa in Costa is ama, and ama in Shaka is shofa. Likewise, shofa and ama are definitely they occupies the same mechanism, and this shofa condition is not that good. So in any of the treatment you are giving, and you might have read that when the nidana of shofa, it is clearly mentioned that shofa is mithya upakranta janitam. Mithya upakranta means when you are treating for a particular condition and your treatment is not good, or your treatment is not accurate, if there is an edema is developing, that is not good. You know that a generalized edema is usually occurring from renal conditions, hepatic conditions, as well as from some of the endocrine conditions, whatever it may be. But some of the basic mechanism of fluid or electrolyte imbalancing has lost, that is causing the edema. You have to watch for this symptom very carefully. And particularly in a person, suppose you are managing a kushta patient with localized applications and all, of course that kushta is a sort of kushta is subsided, but there is a slight edema over that region. That is not good. So very watch out for bad signs. That is, shofa is not good. It is clearly mentioned in our textbooks that it is Mithyopakranta Janitam, and even you look for Rishta Lakshanas and all that Shofa is appearing in quite often in thing. And another thing is that sudden change in functions. So of course, you know that sudden change in functioning of that organs are is not good. An organ is stop functioning, or and an organ is functioning quite in an exacerbated way. Increased urine elimination and decreased urine production and increased urine production, both are equally important. So sudden changes in functions of a person admitted in your hospital or debilitated person is not a good thing. And particularly look for electrolyte imbalances. Electrolyte imbalances in an elderly person who is in a debilitated person is not a good sign, and you have to approach it with very carefully and in a proper manner. So this electrolyte imbalance and uncontrolled diabetic conditions, uncontrolled blood pressure, all those things will definitely damage the entire body system. So if you are not successful enough in managing your patient's diabetes or your patient's hypertension, please refer that patient to another expert, another Ayurvedic experts, or whoever it may be available there, and take higher opinion of doctors. So it is not a matter of ego or something like that. If your management is not giving proper change in your patients, it is clearly mentioned in Ashtanga Sangraha. On a general rule, 7 days is the rule. Saptahena guna alabhe kriya manyam prayojit. That is the guideline given by Bheshaja Vajraniya Adhyayam Ashtanga Sangraha Sutrasthana. It's very important. So sudden change in functions, appearing of shofa, all those things are not good. It's our clinical symptoms of clinical arising clinical worsening of situations. Body color or odor. So the change in body color or change in body odor, all those things are not good. I will give you an example, a jaundice. A jaundice is not a good sign. We usually take it very lightly, but a jaundice is an early indicator of hepatic cell damage. So be very careful in jaundice. A lot of worsened conditions with the liver that starts with the jaundice. And you know that in Kamala, in Ayurveda also Kamala, where this it is that Haridra Varnada or Harita Varnada or Haridra Varnada, it is not a good sign. That is the involvement of Pitta in Majjadha. So that's not a good sign. Or even some order, peculiar order may come. So that is, you have heard that some of the dogs can smell COVID-19, and some of the countries utilize that too in the recent past. So that change in the usual order, because dogs are very best in smell, they usually recognize their owners utilizing that capacity. They can easily detect smallest changes happening with the pattern of the sweat and all. So these signs are not good. So particularly, I would suggest that edema. One of the main thing you probably encounter in your clinical practice, or encounter even in your home or even in your neighborhood, is definitely cardiopulmonary malfunctioning. So you have to be. So we will discuss that and also with some of the abdominal conditions, and we will stop. That is the thing. Dr. Jasul, how much is our time? How much time we have?
So you can continue, sir. We have time. You can continue.
Yeah, up to give me an end point, please. Okay.
Sir, almost like 5:36.
Okay, fine. Okay, that's good. So early identification of cardiopulmonary malfunctioning. So I just this is the cardiopulmonary system is somehow it is we know that it is commonly damaged. In India, IST conditions as well as some of the central nervous system conditions are probably arising from cardiopulmonary systems. So proper history is always necessary. So see, detection of clinical emergency is a skill that you need to attain after learning proper clinical diagnostic procedures. Without having that skill of diagnosing diagnostic skill, you may not be able to detect even clinical emergency. If you are not able to detect that disease conditions, common disease conditions, the early detection of severity of illness may not be possible. So this is a skill that you need to acquire with constant reading and constant practice. So proper history taking is so important. Actually, Ayurvedic physicians are supposed to have that skill very much, because we rely much on history taking. We rely much on interacting with the patients. We have actually the Ayurvedic textbook have elaborated thousands of clinical symptoms, beautiful symptoms through which we can detect what exactly happening in a patient's body, what exactly is the pathology. But we are not utilizing that. So we need to interact with the patients. We have to create that rapport and interact with the patient sufficiently to extract what is happening in the pathology. In order to elaborate and in order to understand that pathology, definitely you need to have a thorough knowledge in anatomy and physiology, and of course in Ayurvedic sciences too. So a general examination is a system organ specific examination is also there. So what are the symptoms? You know that some of the symptoms in cardiopulmonary conditions, chest pain is there. Chest pain that is originating from the center part of the chest, a gripping nature. It is radiating to the right arm or the left arm, or the back of between your scapula, in the back between your scapula. So I will just explain. You just say a chest pain is having a very peculiar feature. It may that origin will be there in the central part of the chest, and it may radiate to the right arm, it may radiate to the left arm, it may radiate to the lower jaw, and it may even radiate to the back. And you feel that a chest pain that is originating from the center of your chest and radiating to your jaw is always a chest pain. But all other thing, a chest pain originating from the chest and radiating to the right arm or left arm may or may not be a chest pain. But if it is radiating to the lower jaw, definitely that would be probably a chest pain. So there will be sympathetic stimulation. When there is a severe pain, a sympathetic stimulation will be there. The symptoms of sympathetic stimulation is that over sweating will be there, diarrhea will be there, vomiting will be there, and all those symptoms will be there. This indicates in a sympathetic stimulation that means that this patient is in desperate pain. If you have an acute abdomen, definitely there will be symptoms of sweating, diarrhea, etc. will be there. Even in severe dysmenorrhea, the person may develop diarrhea and all those things. So the cardiac pain, chest pain is also severe. So the patient will experience the sympathetic stimulation. There will be probably there will be sweating, diarrhea, all those things. And another symptom of cardiovascular system is cyanosis. Cyanosis can be two types, that is central cyanosis and peripheral cyanosis. Peripheral cyanosis is somewhat a somewhat lesser severity, but central cyanosis that involves the tip of the nose and lips are a bad sign, that indicating that there is a perfusion of the blood from the left to the right to the left, not from the left to the right, right to the left. That means right part carries deoxygenated blood, then deoxygenated blood is mixing with the oxygenated blood, and the oxygen level is reduced somehow, and that blood is circulating in the body. So it is a weakened left heart. There will be probably a central cyanosis will be there. Cyanosis and intermittent claudication, all those symptoms are very important. And the age, what are the sex, the smoker, alcoholic, lipid level, physical activity, obesity, diabetes mellitus, hypertension, all those informations, the sleeping habits, all those informations are quite important while you are in general practitioner, while you are a general practitioner. So when we are examining cardiopulmonary system, you just look for the nails. Nails are important. Nails are always important. So even in general, even if not you are looking for cardiopulmonary conditions, when you are examining a patient, do not miss this condition. This part is nails. Nails will tell you a lot of stories, whether there is a nail clubbing is there, finger clubbing is there, that is looking for poor perfusion to the lungs, or so many other conditions. And the color of the nail, the brittleness of the nail. If a nail is brittling with a pain, that means the blood is not reaching that region. So that nail is important. Then tongue, the color of the tongue, whether the tongue is coated, if there is an infection, if there is ulcer conditions and all those conditions, the tongue is involved. And the sleep pattern is so important, starting from anxiety, hormonal conditions, and pain, chronic pain, all those things will affect the sleep. The bowel habits, so important. Bowel habits and how you feel, in general, how you feel about that patient, that is also important. Whether the patient is really look ill, or the patient is look healthy, or the patient is look very weak. So that feel of the patient is also important. So when you are looking into this cardiopulmonary system, this is the order of examination of circulatory system. This order is so important. First, you have to look for arterial pulses. The code word is here ABVP. ABVP. A stands for arterial pulses. So in arterial pulses, you have to look for the rate. The first you look for the rate. Next, you look for the rhythm, the volume, and the character. The rate is slow rate, regular rhythm, but the volume is full. That sometimes the patient may have a hypertension. So by practicing pulse reading regularly, I'm not talking about the pulse reading vata pitta kapha like that. I'm not well aware of that. But by looking into the pulse of a patient, you can that is so important. The circulatory system status you can easily assess. The rate should be consistent, and it should be regularly. The rhythm should be regularly regular, and the volume can be full or a thin volume with increased rate, indicating a bleeding, tachycardia, and bleeding. So the character is assessed in usually in carotid artery or something like that. So these arterial pulses you have to look for in radial pulse, as well as in popliteal artery and in dorsalis pediceti. So whether if a person is having a limb pain, the peripheral pulses are important. If a peripheral artery is affected with a atherosclerotic plague, you must look into similar plagues in other parts of the body. Likewise, in whether the coronary arteries involved, whether the middle cerebral artery involved. So the health of the peripheral arteries are also important. So when when you are examining the circulatory system, it is also important to examine the peripheral pulses. So next, after arterial pulses, you focus on blood pressure, particularly systolic blood pressure. We are taking for emergency situations, particularly focusing on systolic, and diastolic blood pressure are a usual clinical practice, and blood pressure is based on diastolic. So the diastolic blood pressure and systolic blood pressure both are important here. And venous pulsations are important. Jugular venous pulsations and elevated jugular venous pulsation is seen in congestive cardiac failure, right heart failure, and all those things. And examination of the precodium. Precodium means the area overlying the heart is known as precodium. You have to inspect, palpate, and percussion. And the last one is auscultation. So the first thing when we do, when a patient is complaining about a chest pain, or complaining about a tachycardia, or complaining about a palpitations are a very important thing. Or a sweating or a chest pain, the first thing you do is to auscultate them. But auscultation you can do if it is necessary, but all the things you have to understand, what is the status of arterial pulses, what is the blood pressure and venous pulsations, etc. So this is the cardiopulmonary system examination. And if there is a chest pain, the thumb rule is to give if possible, to take two antiplatelet drugs or aspirin or sorbitrate like thing, and transfer the patient immediately to the nearest hospital having facilities. So let us also move with some of the abdominal examinations. That is the art of informed touch, because majority of the time, apart from infections and these cardiac conditions, and of course from stroke, because stroke are so evident that most of the time that there will be some neurological stimulation or neurological response loss will be there. So it gets somehow you can easily detect that. But acute abdominal conditions are usually arise in common practice. So you can see that what are the organs there in this 9 area of abdomen is so important, because when you are referring a patient with abdominal pain, you have to draw these lines. Simply you draw these lines like this. You just draw this 4 line like this, and you just mark the area having pain like this. You can mark the area with the patient is having a area of tenderness. You mark like this, or you.
Hello, sir.
Hello, am I okay?
Yes,
Okay.
now it's okay. Yes.
Okay. Okay. I hope the slides are visible, right?
Yes, yes.
Okay. So you can see the organs underlying the each area. The first one is the hypochondriac area, right hypochondriac and left hypochondriac area, and the epigastric area, right lumbar area, umbilical region, left lumbar, left iliac, hypogastric region, right iliac, left iliac, and hypogastric region. These areas you must be very well aware, and you also, as I said, that you can draw these lines only. There is no need to draw the abdomen as a whole, but you write these lines, and you mark the area of tenderness while you are putting the patient, while you're sending the patient for an investigation like a like a scanning or something. Definitely the person, the doctor who is attending that person will be well aware of the condition, and he can focus that area also. So see, usually the umbilical region, the pain around the umbilicus represents usually when a patient will tell you that I am having an abdominal pain, I am having a stomach pain. For patients, everything is stomach pain, whether there is a pain in the epigastric region or the hypogastric region. Usually, definitely the pain will be, the patient will have the, patient will only say that I am having a stomach pain. So you have to ask the patient where exactly the patient is having the pain. Sometimes the patient will point with a finger, I am having a pain here. Pointing with a finger is not a feature of an organ pain. Usually not a feature. Likewise, a chest pain, the patient will never localize a chest pain, that the patient is exactly telling that I'm having a pain over here. With an index finger, he or she is telling that I'm having a pain. Mostly it will be a costochondritis or something like that. What is the, how a patient will represent a chest pain? He says, I'm having a pain over here, I'm having an abdominal pain like this. So they may not be able to localize these kinds of pain. So a pain around the umbilicus means usually the organ representing that is small intestine. Duodenum, small intestine, parts of the small intestine and duodenum, the pain will be around the umbilicus. And the epigastric pain, you can see that the stomach, liver, pancreas, duodenum, spleen, and adrenal glands, and the representing the epigastric region. And you also must understand that some of the cardiac pain the patient will present as stomach pain. So you have to rule out the stomach pain, and severe stomach pain also will elicit a sympathetic stimulation. Of course, you have to rule out. The thumb rule is that you need to rule out the severe condition first. So first you rule out that if this person is not having any cardiac conditions. So the epigastric region, you be usually looking for the stomach conditions and all. Right hypochondriac region, we have liver, gallbladder, etc. And left hypochondriac region, we have spleen, colon, kidney, etc. Right lumbar region, gallbladder, liver, and all those things. And left kidney, right kidney is there. Right iliac region, definitely we are looking for ovaries, appendix, cecum, etc. Hypogastric region, that is urinary bladder, etc. And left iliac region, left ovary, and all those things. And of course, these urinary system is also there. Okay, so ureter will be there in that region. So a person is complaining about a stomach, acute abdomen. So the acute abdominal pain is of two nature. One is inflammatory conditions, inflammatory conditions, and acute inflammatory conditions, and acute colicky conditions. What is colicky means? When an organ, a hollow muscular organ is obstructed with something, it will cause a pain. A hollow muscular organ is obstructed with something, it will cause a pain. That pain is known as colicky pain. It is of a mechanical nature. And if it is of a sorry, So you just think about the small intestine. When that small intestine is obstructed with something, there will be a peristaltic movement for this hollow muscular organ. So there will be intermittent pain. Intermittent pain, there is a gripping pain and it is intermittent. The patient will, when that pain comes, the patient will roll over on the bed. Or that is so important. That is a very important feature. The patient will have cyclic pain. Instead of a continuous pain, there will be a cyclic pain, and the pain will exacerbate in between, and in between he will breathe. So that pain is a typical feature of that. It is a colicky pain. So what are the organs in abdomen that can cause an acute colicky pain? Of course, the duct of the gallbladder. Definitely, it can be obstructed with a cholelithiasis. It can obstruct with a stone, and definitely it can cause a sort of a colicky pain. And the severe condition you have to look for is the intestinal obstruction, induces intestinal obstruction. The other features are there will be severe pain, colicky pain, and the person will start vomiting, and fecoid vomitus will be there. Or he will empty the entire content right from the obstruction, site of obstruction, up to the stomach. He will vomit out, and will be prostrated and will be very tired. And it's a surgical emergency. So when there is a colicky pain, you have to rule out intestinal obstruction. That is the thing, and the pain will be around the umbilicus, and there will be sometimes absence of the bowel movements will be there. So it is very, very important. So that is the first thing. So the next thing is that when a stone is obstructed in the pelvis, renal pelvis pain is otherwise in kidney there will be continuous pain, but in renal pelvis the pain will be of a colicky nature, and that renal pelvicular pain is known as the renal colic. Actually, it is not the renal colic, it is a uretary colic. That pain starting from the groin and extending to the loin and or to the tip of the penis or tip of the clitoris. That is typically a renal colic or known as a uretary colic. So that is also a colicky pain. It will come intermittently and go. So that is these are the common colicky pain that we encounter in acute abdomen. And the next set is and of course, if you have some obstructions in the rectum or any hollow muscular organ, possibly you may have this kind of pain. And another is infectious conditions. That is acute inflammatory conditions of bowel inflammations or appendicitis, acute appendicitis, pain, vomiting, temperature. The patient will have pain, so slowly he develop vomiting and then temperature. This triad is so important. That is again the initial pain, since appendix, the referred pain of the appendix is to the umbilicus. Is the initial pain is around the umbilicus. Later, when the omentum is involved, the peritoneum is involved, the pain will be felt in the Mugburny's point. You know the Mugburny's point. The first thing you need to rule out is acute pancreatitis. Pancreatitis is the inflammation of the pancreas, and the patient will prefer to sit and bend over. So the feature of acute infective pain of the abdomen is that the pain will be continuous. Unlike the colicky condition, the pain will be continuous in infective conditions. So acute pancreatitis will be there, and some of the stomach gastritis conditions, acute hepatic conditions, hepatitis, etc., etc. The pain will be continuous, and the patient always always prefer to stay still or lie still or sit still. That is the feature. If there is generalized peritonitis, if some bowel rupture has occurred or appendicitis has been rupture has been occurred, there will be peritonitis can occur, and once that infection is surfaced out, the patient the pain will be severe, and the patient always prefer to stay still. But in a colicky condition, the patient will roll over the bed. And usually in urinary bladder pain, the pain will be on the hypogastric region, and ovulation and ovulatory pain will be on the right or left iliac region. Urinary bladder conditions, cystitis conditions, infective conditions, there will be increased micturition, and Pain increases soon after micturition is a feature of cystitis or urinary bladder condition. So these are the some of the clinical acute abdominal conditions coming to your Okay, so improving clinical skills. You have to observe your patients, you have to listen to your patients, you have to feel the patients, and you have to talk properly to the your patients. These are some of the communication and necessary clinical arts: art of inquiry, art of listening, informed touch. So that is very important. I just explained that palpation. This palpation is a very important art or clinical skill that is necessary to obtain many of the clinical severity of symptoms. So you have to keep your hand like this. It's always horizontal to the body of the patient. It should not be perpendicular. That may harm the patient. And these are the conditionalities of palpation. So try to palpate. While that is known as informed touch. That informed touch is a clinically very important. If you quite often you're touching your patient with a well-informed touch to the patient, that patient will appreciate that, and you can gain confidence from the patient, and you can reassure the patient. And of course, a doctor can see much through his fingers than his eyes. It is like that. So this art of informed touch, you learn, understand. For that, you must have a better understanding of anatomy and physiology is necessary. So what you have to do in GP, it is not possible to identify all clinical emergencies or to manage all clinical emergencies while you are as a general practitioner, particularly with Ayurveda. But you have to learn your science with conscience and dignity while you are in general practice. You must have a limit. You must have a boundary. These are all the conditions I'm going to focus, and these are all the diseases I am going to do. And in that diseases too, I'm going to refer my patients if he crosses this boundary. So you have to have that boundary drawn in your practice. So when you are acquiring your experiences, when you are learning more and more, definitely you can redraw that boundary so that you can accommodate more and more severe conditions effectively, so that you can manage those conditions also. So improve diagnostic and clinical skills. That is so important, because I have observed that we are more focusing towards the learning which yoga to be prescribed for a particular condition, which medicine you have to take, what are the new proprietary medicines available. But medicines come second. The true skill of a doctor lies in his diagnostic and clinical skills. Because if there is a proper diagnosis, this is Vadarekta, or this is Vadashonada, or this is Amovada, or this is Sandhigata Vada, or this is this particular Kushta, probably a person who can refer to textbooks and prescribe a medicine. But to diagnose that properly, definitely your diagnostic and clinical skills should be optimal. So sharpen your basic clinical skills and add advanced skills every time. So you have to keep every time at least a few hours or a few minutes in your day-to-day life to read something new. Whenever you heard a new medical term, take some time, because all of you are having these mobile phones with you. These mobile phones and internet offering a vast area of knowledge. You simply Google it, what exactly that, look into the definitions and what are the practice essential for these particular conditions. So never compromise in learning. So sharpen the basic clinical skills, can advance each time you advance it. Convert principles into practice by constant learning. You have lot of principles. Ayurvedic principles are available. Ayurvedic medicines are available. You learn it, and you give your patients a basic medications. You can start, you approach your patients with ama, approach your patients as shofa, approach your patients as abhishanda, whatever it is. You prescribe a basic medicine so that you can learn about that patient and learn about that condition deeply, and in the next visit you prescribe a medicine that is very suitable for that particular patient and particular disease. So likewise, constant learning and constant acquiring knowledge, and that will definitely improve your clinical skill, that will definitely improve your communication skill. You can convert the principles you have learned in your textbooks into practice. Those principles either you have learned in Harrison's textbook of internal medicine, or Nidanasthana of Ashtanga Hridaya, or Ashtanga Sangraha, whatever it may be, because all these textbooks are necessary for you. There should not be any classification you can offer. Why? Because all these things are for the benefit of your patients. So be ego-free, be open, and acquire whatever knowledge you can gain and you can have, and improve your clinical skills. That I need to tell to the young doctors assembled here. Practice the medicines and procedures you know, understand the population, and be popular. When you are in a general practice, you have to visit, you have to attend some of the marriage parties, attend to some of the social activities, so that you need to establish your presence there. That would be beneficial for the patients, that there is a doctor is there, doctor is available. That is important. So also you can understand the priorities of the population. What are their common characteristics? What usually they eat? What are their behavior? All those things is necessary while as a general practitioner, because in Ashtanga Sangraha it is clearly mentioned that kasmin nayam deshe jata samvartho vyatito va. That is so important. From where this patient has born, whether this patient is brought up, from where he obtained this disease. So all these things are important. So to be a general practitioner, you have to understand the population around you, and you also a little bit popular among them also. Practice the medicines and procedures you know very well. It is very important. You may select according to the population, or according to the cases coming to you, you may list out certain medicines that cover all these conditions, and you understand various aspects of this yoga or these medicines, and you can skillfully combine the medicines you have learned. Be only 20 or 25 medicines are necessary, but if you learn them properly, you understand them properly, that may be sufficient enough to have these for managing those conditions. Be kind, informative, and ethical. You must be kind to your patient, you must be informative to your patient, and you must be ethical to patients. Ethical practice comes only with good learning. You don't know exactly what the condition is, and you are trying to be informative is a foolish thing, and it's an unethical thing also. If you don't know something, you just tell the patient to attend to some other doctor. So be kind to the patient and be ethical to the patient. Ethical practice always comes from good learning. So try to be informative. See, in a general practice, the patient also not expecting a complete cure from you. Most of the time, they are expecting an advice where to go and what to do. I will just give you an example. A patient coming to you with a breast lump, a pain on the breast, and you are examining that patient informed through an informed touch approach, or informed consent and informed touch approach. But examine the patient, you find out that there is a hard, stony hard swelling. It is irregular in its surface, and definitely that is showing a breast adenocarcinoma or something like that. So you are telling that patient that you have a certain problem, and you immediately go to a regional cancer center, and this patient will go there, and patient will do the surgery, do the radiation therapy or whatever thing, and sometimes he may come to you and you may prescribe some Brahmarasayana to support his health and all those things. You may design their diet and all those things. But the patient, after even though if the patient is not coming to you in between, after completing all the treatment, she or he will definitely come to you and tell that doctor, I'm thankful to you because you have identified this disease. So this is the importance of a general practitioner. advising properly to the patient. If there is a clinical emergency, identify that and advise properly to the patient. And it will save the time, and sometimes it may also save life also. So while you are in a general practice, investigation should always be affordable also. So I know that I'm a little bit deviating from the subject, from the clinical emergency, because since it is general practice is there, that's why I have included these slides here, because sometimes some of our young doctors is not well aware how to behave in a general practices. Writing too much of investigations will give you some money, but it definitely that will destroy the faith of your patients in you. So in long term, definitely that will affect you. So investigations are to be done after professional diagnosis. If you really want to write an investigations, you need to know the pathology, and you need to know the physiology, how that investigation work, why that investigation is work. I will give an example. The elevated SGUT and SGPT means the liver cells are damaged. In a way, it is damaged. Why? Bile. It just is simply tell that anemia. Simply tell that jaundice. Jaundice means that is circulating bile in your system. Why? Because bile is an enzyme. Enzymes are not supposed to be there in the bloodstream. Hormones are supposed to be there in the bloodstream. So hormone level, always there will be a pretty higher normal value. For enzymes, very small normal value will be there. Because in routine practice also there will be loss of cells will happen. Definitely that enzyme will mingle with the blood. So enzymes are meant to produce in a gland, and it is transferred through a duct. So if an enzyme is present in the blood, that means the producing organ or the target organ is damaged. So it is, so you need, when you are looking into a damage, when you are looking into a jaundice, actually you are searching for a liver damage. Likewise, you must be able to interpret each and every investigations. So the common investigations, how to interpret the complete blood count, each of the, what is MCV, what is MCSC, so what does actually ESR means, what is the differential count means, what is ANA means. So it is so important to improve your knowledge regarding investigations. That will help you to write the proper investigation after provisional diagnosis. You must have something in your mind. So I am suspecting this condition. So for to elicit, for to rule out other conditions, I just simply, to reach a differential diagnosis, definitely I need an investigation. So again, understand the therapy also. I already explained that use small yogas, try to prepare medicines, realize that we have nothing in plenty and lot in scarce. That is a very thing. So mere wastage of resources you have to avoid. So prescribing more than necessary medicines and prescribing not enough medicines, both are equally dangerous. Try to prepare medicines in person, in groups. If possible, you can prepare some of the medicines, and if not possible, you can assemble a group of practicing physicians. You can try that. Pathyapathya Vicharam is very important for Ayurveda, and majority of the illnesses, some of the anxiety conditions, or think about a gastritis conditions, without advising proper Pathyapathya, with medicine only, you are not going to cure it completely. So Pathyapathya Vicharam, even though it is a difficult task, you need to carry forward that with your general practice. It's so important to have that Pathyapathya Vicharam even in cardiac conditions. And I wonder now Ayurvedic physicians are somehow reluctant to prescribe this Pathyapathya, and most of the time we talk about Apatyas and we never mention about Pathyas. Instead of giving Apatyas first, you just focus on telling Pathya what they can eat or what they can do. That is a positive approach. That is a positive approach. Well, first you tell that you can eat all those things, and the second part you tell that you can eat all those stuffs, no problem with that. But having said that, I must say that these are the things you try to you sometimes somehow you try to avoid. So that approach definitely will help. That approach will ease out the patients also. skillful use of Panchakarma and other supportive therapies. Of course, Panchakarma therapies are all costly. That of course, if for a regular for a patient, that also will earn you some money. But the problem again, I need to tell you that Panchakarma therapy skillful use is important. Idi doshe which they that is the thumb rule of Kushta, and it is also applicable to all diseases. The antarika dosha, under dosha must be addressed first. The dosha which they ande bahi praleva. After that, external applications are necessary. So skillful use of Panchakarma is necessary, and supportive therapies are always okay. And while you're practicing in a rural setting, the major focus should be to infectious diseases, because every time several types of fevers, vomiting, diarrhea, respiratory infections, dermatological issues, etc. are coming, and you have to focus what are the emergencies associated with the fevers. You can tackle with that severely early what is going, no problem with that, and how you are going to manage vomiting, diarrhea. All these things, diseases are coming quite often with the rural setting, particularly in Kerala. I'm talking about Kerala. And you also need to know how will you manage the preliminary management of trauma and injury. Because when a person got a trauma in front of you or in front of your clinic or hospital, and he is carried to your hospital, there is a fracture or something like that, and there is a bleeding, you know what to do as a preliminary management. You have to attend that patient and you do some preliminary management, then refer the patient accordingly. So that is important, and counseling and proper guiding of the patient is also important. So you know a sort of counseling techniques and all. So you must have a policy in managing diabetes mellitus, hypertension, genitourinary issues, CVD and CVA. You must have a policy. To what extent I will attend these patients? I mean, what if I do if a patient comes with coronary vascular diseases and coronary vascular accidents, cerebrovascular accidents, and all those things? So acute abdominal conditions. These are the common situations coming here in Kerala. And of course, our ISM medical officers and all are well doing with managing these conditions. And you can interact with them also probably. That would they will give some real-time experience in practicing from. I'm actually practicing in a medical college with much more facilities and much more specialty doctors are available. Probably if a practitioner in the rural setting who can come and explain how they are addressing these conditions, that would also be better, I think. So some types of neoplasms, eye and ear infections, pain management, how you manage chronic pain. Ayurveda can better manage chronic pain than acute pain. Actually, for chronic pain, there is no management in any of these systems. They can only supportive care, and definitely Ayurveda can do better in chronic. That's why in palliative care framework, Ayurveda is a lot, and foreign body, insect bite, acute poisoning, all these conditions are appearing as clinical emergencies in our conditions, and of course diagnosis, death diagnosis and management. So this word I am telling here, the pessimist always complains about the wind, the optimist expected to change, and the realist adjust the same. I always keep this sentence. So by learning everything, definitely you cannot go into practice. So it is the practice, the learning and acquiring experience should go hand in hand. That is the thing Ashtanga Sangraha also telling in Bheshjavajanani Adhyayam. And the optimist expected to change. Optimist may wait to change, but the realist adjusts the sail. So we have to move forward by learning and acquiring experience. And always like a realist, you must be a doctor, must be a realist and move forward with confidence, with conscience, with learning and understanding. So let us sail. Thank you so much.
First of all, let me thank you so much for this wonderful session, sir. As emergency medicine is something that most of the Ayurveda doctors lack. So with this presentation, I guess our participants must have got a wonderful experience as you have shared your experiences. So once again, thank you so much from on behalf of Ayurveda Map, sir.
Thank you.
Sir, we have 2-3 questions in the chat box. Can we have a discussion, sir?
Yeah, please. Question answers QA. It is QA. Please repeat
Yes,
the
sir.
sloga. Yeah, Shaurya Mashikriya, Shastra Taushnyam. So it is there in Susruta Samhita. I think Susruta Samhita, quality of a surgeon. So you may refer it and kindly read the explanation given by Delhana also, because he has elaborated that beautifully. Okay.
So next question we have in the chat box. Why diastolic pressure not included?
Yeah, actually, that is it's a very standard scale, that severity scale. It has been researched a lot and it has been modified recently for COVID also. This scale has been modified because that in severity conditions, most of the time this systolic is affected, and systolic can be a better judgment, will give you a better judgment than diastolic. That's why probably systolic has been there. That's it.
Okay, sir. Participants, if you have any questions, please keep on posting it in the chat box or in the Q&A section. Sir, we'll go to the next question, sir.
Yeah, please.
Sir, patient 26-year-old female have severe navel pain from 1 month. She had IBS type symptoms and abdominal pain from 5 months. All reports were normal. USG also normal. So can you please tell the further investigations that we have to conduct?
I think a proper examination must be conducted. A proper palpation and proper examination must be conducted, because if not visible anomaly in the USG, right? It is USG they are telling, right?
Yes.
Yeah. Sometimes it is musculoskeletal. Sometimes it's musculoskeletal or referred by. Alternate investigations are a little bit costly. You may go for CT or MRI. But I would suggest, before going for that, have a thorough physical examination and history taken. That is necessary for that.
So Dr. Malti had asked this question. So Dr. Malti, if you need further explanation, you can ask. I hope it's clear, sir. Sir, next question. Sir, patient 30-year-old female having pain in right breast near sternum, radiating towards the right arm. No cyst, mammography normal.
Pain in the right breast.
Yes.
Okay. Radiating towards the right arm.
Yes.
Okay. Mammography turns normal. Okay. Pain radiating from the right breast. Okay. Again, definitely that physical examination is necessary. Mostly it is costochondral origin or intercostal muscle pain. The problem with the muscle pain is that I will just explain that a bit. A muscle is constituted by a belly and origin and an insertion. Okay. A muscle is constituted by an origin and a belly and insertion. If any part of this muscle is affected, the problem is that the pain is radiating to both and as well as to the belly. Particularly if the belly is affected, the belly is contracted, that pain will radiate to either side. So if the mammogram seems to be normal, and if the particularly see that whether if the patient is localizing the pain, I will just show that the patient is telling that I'm having a pain here, just like localizing this, mostly it is of a musculoskeletal origin. And if it is having a generalized breast pain, she will probably tell like that I'm having a pain over here, or pain over here, or pain over here. So whether that kind of simple things are very necessary. So if the mammogram came normal, and I think that it is quite normal to have, the age is 30. If it is normal to have breast pain, sort of breast pain in females, it's quite occasional. It is associated with the usual hormonal cycles also. So check out that part also. Okay.
Okay, sir. Thank you. Sir, next question. What is the indication of higher systolic and diastolic blood pressure?
Indication of higher systolic and diastolic blood pressure. Okay. Higher systolic blood pressure, definitely blood pressure is always telling you higher diastolic blood pressure means the heart is functioning in a high pressure. That is the thing, because the difference between diastolic and the systolic means the pulse pressure. So this pulse pressure is pushing the blood throughout your body. So the higher systolic blood pressure, there is high chance that there is CNS damage. There is probably there will be stroke, etc., etc. And for the diastolic problem is the higher diastolic will cause you damage in the heart, because the heart is functioning in a higher environment. See, the elevated diastolic pressure usually can cause a left ventricular hypertrophy, so a hypertrophied heart. So the constant diastolic blood pressure is not good for the heart. And if there is a higher side systolic blood pressure, etc., that can definitely affect the renal perfusion and the eye issues, hypertensive eye changes, retinopathy changes like this. That is the thing. The diastolic is mostly much more harmful to the heart than the periphery, and systolic is much more harmful to the periphery than the heart.
Sir, can you suggest a drug for instant relief from headache due to exposure to hot or even?
No, never. I cannot. Not even. I don't think that any doctor can do that, because headache itself, that headache itself, headache is a very bad thing to treat, because headache can arise from a lot of things. It is a normal variant. That as a female, that it occurs as a part of your usual hormonal cycles. Even a high amino acid diet can cause you headache. You're going for a biryani, chicken, etc., and suddenly you may get and of course in psychological conditions, in emotional exacerbations, in some of the anxiety, likewise, and in neurological conditions, and certain diagnostic things are there. Usually if a patient is arising from the bed due to a headache, that headache is a worrisome headache. Most probably it is arising from an intracranial tension. A patient is waking up due to headache. It's not a good sign.
Okay. Sir, how to differentiate inflammation on patients with lower limb, whether due to muscle spasm or fracture or drug induced?
Okay. See, sprain or fracture, there must be clear onset, clear history. The history will be clear. There's no doubt about it. The patient is telling that I have jumped from something, and the onset will be very sudden. And in case of an inflammation, sometimes definitely it may be a the condition will be slowly aggravating, and there will be clear signs of inflammation will be there. But in case of sprain or fracture, the things are quite different. There are specific things. There is nothing you need to worry about how to differentiate between. There should be probably a confusion regarding sprain and fracture. But inflammation and sprain or fracture, mostly they have a clear demarcation. No problem, no worry. And if a fracture or sprain site is inflamed, that is a different condition. That also we can easily detect. There will be localized tenderness, increased tenderness. There will be localized temperature will be there. Inflammatory signs will be there, and it is most of the time if it is there is a connection open sprain or open fracture, the condition could have been worse or would have been worse depending upon the cause of that inflammation. If the cause of that inflammation is infection, sometimes some gas producing organism can cause inflammation. It can cause compartment syndrome. There are so many things are there. So it depends upon, regularly inflammation, sprain and fracture, they are not in the same differential diagnosis pattern. Okay.
Okay, sir. So just one last question. Sir, what will be the normal range of the difference between the diastolic
40. Pulse pressure 40.
Okay, sir. So that's the end of the questions we have.
Thank you.
Now I invite Dr. Jasul for the conclusion.
Yeah, thank you, sir. Thank you very much for your this presentation, and it gives the accurate guidelines how to approach all these cases, and definitely it is helpful in our practice. Thank you very much for your
Thank you.
support. This of lectures are needed from you, like senior doctors to juniors, to improve our clinical practice. Thank you very much, sir, and keep it up. Okay.
Thank you.
Thank you. Over to you, Dr. Radhika.
Okay, so that's the end of the session. So now we'll wind up the session. Thank you everyone for joining us in this session.
Yes, we have so many feedbacks in the chat. Okay, thank you all for the feedbacks.
And also I thank Dr. Alikuti's pharmacy for giving us this chance of this lecture. So thank you one and all. Thank you, sir.